move forward with a passage of state-based, publicly funded universal health care. Many of us believe that following the Canadian model, where one territory, province, set up a universal healthcare system in their province, and the leader there was Tommy Douglas, who was a surgeon, actually. Within 10 years, the entire country had universal health care because it was such a good idea. So the strategy with one-payer states is that one state will get it, certainly before the federal government gets it, and it might be Oregon. And then another state will get it, and another state will get it, and then it will be unstoppable pretty much. So it's a social cultural change. It's a big change, but that's why in Oregon we are focusing our efforts on a state-based universal healthcare system. The legislature had commissioned the RAND Corporation to look at this, and in their analysis in 2016, they came to the conclusion that there's already enough money in the state of Oregon in healthcare that we can do this without having to pay any more money than we're already paying between premiums and deductibles and copays and the Medicare and Medicaid money. The money's already there. So why don't we do it? And internationally, there are many other countries that have done this, and there's a significant cost savings. If everybody has access to health care, the population health is better. The World Health Organization has documented this. We're number 12 in the listing of international countries that have health care. World Health Organization keeps track of these, as well as economics and farm produce and all kinds of other statistics. So these other countries have they have better health outcomes, and they spend a third to a half of what we spend in this country. But primarily, if you ask someone from a country that has universal health care, say, well, why do you have it? And they'll say, well, why don't you? Why doesn't the United States have it? It's the right thing to do. Yeah. And some of that is based in our cultural traditions. What our society is based on, what their society is based on, and a good part of that is the Judeo-Christian traditions. And so I just want to start off with this is not a business group. This is a faith-based group, and so I'm approaching this more from a values and ethics perspective, and what are our fundamentals. And so the question for a long time, and documented in both the Old Testament and the New Testament, am I my brother's keeper? That's a question mark. And the rest of the Old Testament, the rest of the books in the Old Testament and the New Testament provide stories as to try to answer that question. And I believe it's in Matthew, the disciples ask Jesus, well, what does it take to be a good person? And there's three answers to that question. When I was hungry, you fed me. When I was naked, you clothed me. And when I was sick, you came to me and you treated me. And this is why I choose to focus on the moral imperative. You talk to people, you give them all kinds of statistics. That doesn't change their mind. What changes their mind is what's in their heart. And if you come to the fundamental that's in your heart, you base that on what you grew up with, what your traditions are. And so that's why we're going about this in the way we're going about it today. We've just selected 3 parts of Senate Bill 770, the encompassed within the purpose and the principles of, we're not going to talk about which services are covered and, how do you pay for this and all those other things. We're just going to focus on the moral imperative of doing this. So what we thought we would do we will take each of these groups, these 3 sections one by one, and I think what we decided was that we would have a volunteer just read the first section, which is section 3. Just read it to all of us, and then we'll discuss it for about 10 minutes, and then we'll move on to the next section, and then the next section. So do we have a volunteer who would read the section 3? It's a short section. Who would like to read just what's written in 770 on section 3?
You're a good reader.
I can do it. Yeah, I can do it.
Which is about the values, right? Section.
The Task Force on Universal Health Care shall produce findings and recommendations reported to the Legislative Assembly as provided in sections 6 and 8 of this 2019 Act for a well-functioning single-payer healthcare financing system that is responsive to the needs and expectations of the residents of this state by first, improving the health status of individual families and communities. Second, defending against threats to the health of the residents of this state. Third, protecting individuals from the financial consequences of ill health. Fourth, providing equitable access to person-centered care. Fifth, removing costs as a barrier to accessing health care. Sixth, removing any financial incentive for a healthcare practitioner to provide care to one patient rather than another. 7, make it possible for individuals to participate in decisions affecting their health and the health system. 8, establishing measurable healthcare goals and guidelines that align with other state and federal health standards. And finally, promoting continuous quality improvement and fostering inter-organizational collaboration.
So the task force is tasked with developing a plan for how to incorporate the purpose, the values, and the principles. And so these are very fundamental things. Now, I'm not sure if private insurance companies have a stated purpose for their insurance, but I doubt that they conclude all of these items. So if we could just take a few minutes to talk about, this purpose for the task force. Does this seem like something that's heading in a direction that would make our health care system better? Any thoughts on that?
Well, one of my thoughts was when I read this was just my own personal experience a few years ago when our doctor that we had in Texas, we'd had this doctor for years. My husband and I traveled a lot, but we would come back and go to her. And suddenly I went to the office and she was dropping us because she was no longer accepting Medicare patients. And I never even got a chance to talk with her or even tell her goodbye. The secretary, was the barrier there. And it just, I felt abandoned, really, in a way. It was not a good feeling. And I had a friend who tried to go to her on my recommendation, and husband tried to get his wife in to see her, and he said she won't accept Medicare patients. And I said, well, we're Medicare, but anyway, not any new ones. But then she dropped the ones that she had, and I'm just thinking all the people who are rejected for one reason or another. It's, that I'm lucky I found another doctor. And then another thing that I wanted to bring up, a question that I have, because, and I'm not sure if that fits into this part, because it's talking about aligning with other state and federal health standards and, things. One question that comes up when we're canvassing a lot of times and talking to people is, am I going to lose the health care that I already have? Am I going to have to give up the benefits that I already have? And when my daughter Jennifer put this question to me and asked me if I was willing, I said, you mean I have to give up my TRICARE? Because TRICARE is really good. It covers whatever Medicare does not. And so I think it's best. I don't want to lose that, of course. And she said, yes, you will. But then is there going to be a coverage as good as Medicare and TRICARE that covers everybody? That is what I'm wondering.
So I'd like to just pivot on that a little bit and look at the purpose section. So I think what you're talking about is that cost was a barrier for you in your interaction with your physician in terms of you accessing healthcare. There was a money issue, right?
I am thinking that's why she dropped her Medicare
Right.
patients, because they didn't pay as much as the
So
insurance
the task
companies.
force is tasked with making sure there aren't barriers like that.
Okay.
And that's why it's important to have that particular item for many reasons, but that's one of the reasons why it's important to have that in the legislation as a purpose of what the system would look like. It would remove barriers, financial barriers, to accessing healthcare. And there's many aspects of that, right? There's the aspect that you were just talking about with your experience. There's the another barrier is people who have health insurance, but they have $1,000 deductible and they can't really afford the deductible. So there's a financial barrier for them to get access healthcare because they really can't afford $1,000. They need that to pay for the mortgage payment or pay the rent or buy food or clothes for their family. So that financial barrier is one of the reasons that a universal healthcare system is a better system, because there are no financial barriers. So I don't know if that helps. Yeah, that's how I'm thinking about it.
I'm thinking when you're talking about financial barriers, people that have insurance and then their copay is so high that they have to put it on a payment system. And I have had this experience with my daughter, and she had an emergency situation and was in the hospital for one day for testing and all these things. And then her bill it's really very, very, very high at the hospital, and she needed to put it on a payment plan. And this was in Washington. They would not accept the payment plan. She had to pay it off within 1 year, and she couldn't do that. And so it was very complicated for her. So would that not happen to people? People need to know that they're going to be covered and helped wherever they need in a universal system, because some people's insurance would pay it and they would extend it as long as you need it, but other companies don't. So what's sort of will this system ensure that you get the medical care and that you don't have to go without bread and milk for your children to pay off your bill?
Yes. No other country does it that way.
Does it that
No other civilized country does it
That's
that way.
exactly, yeah.
So the answer is yes.
Yes. And that will be really important to be able for everyone to know, because
Yeah.
people in the lower income brackets, they struggle to think about how they're going to pay for the bill, so they don't go to the doctor.
Exactly.
And then when they do go, the bill is much higher. So there's a lot of work to do to convince people about this.
Well, that is part of the obstacle.
Right.
And part of the task of the task
Task
force.
force,
There will be public meetings around
Yes.
that. But yeah, remember the RAND study
Oh, yes.
already said
Yes.
there's already enough money in the system,
Right.
and you have to start thinking about it. You're not going to be paying that money to a insurance company that's got duties and responsibilities to shareholders.
Yes.
You pay it into a public trust, which will then
Help everyone.
be a pool for the entire state.
Yes.
So that's the concept.
Yes.
This is wondering, will doctors be, I don't know, do they have to take everybody under this plan? In other words, people that are worried that they're going to lose their doctor because the doctor won't be part of the plan, are all the doctors going to be included in the plan? All your specialists, everybody?
Yes, yeah. So anyone that's certified by the state, by the medical board, would be included in the plan. Yeah. And there would be no reason to choose one patient over another, because the reimbursement, as in all these other countries, the reimbursement is the same no matter who you go to see for that problem. So you don't have to make that choice. We could spend the rest of the morning talking.
There's
a lot of issues.
Any other comments on the purpose section that people want to bring up?
I had a question on
Yes.
8 more than on that. So what's the point? I mean, I can think of a few points of why we want to make sure our goals and guidelines align with other states in federal health. I mean, I can see why the standards, you want all that kind of a certain quality of medical care. Is that what it's getting at, or is it like that this state is giving the same type of care, offering it to everybody in the same manner that another state would? So you could take 2 shots at that.
And the task force will need to sort that out.
Oh, okay.
But the concept is that within federal guidelines, in order to get federal money into the state, there are guidelines that must be met as far as services go.
To qualify for the money.
Right. Yeah.
Okay.
Exactly. And so I'm not quite sure how they're going to deal with the state part of it, but certainly the federal part will need to be dealt with.
Okay.
So good question. Others on purpose? So maybe we could move on then to values. So who would like to read the values for us?
I'll read it.
Oh, great.
The Task Force on Universal Health Care, in developing its recommendation to the Legislative Assembly for the Health Care for All Organ Plan, shall consider at a minimum the following values. Number 1, health care as a fundamental element of a just society is to be secured for all individuals on an equitable basis by public means, similar to public education, public safety, and other public infrastructure. Number 2, access to a distribution of healthcare resources and services according to each individual's need and location within the state should be available. Race, color, national origin, age, disability, wealth, income, citizenship status, primary language use, genetic conditions, previous or existing medical conditions, religion or sex, including sex stereotyping, gender identity, sexual orientation, and pregnancy, and related to medical conditions, including termination of a pregnancy, may not create any barriers to health care, nor disparities in health outcomes due to access to care. Number 3, the components of the system must be accountable and fully transparent to the public with regard to information, decision-making, and management through meaningful public participation in decisions affecting people's health care. And number 4, funding for the Health Care for All Organ Plan is a public trust, and any savings or excess revenue are to be returned to that public trust.
So let's spend about 10 minutes talking about the values section. things that come to mind, good, bad, or indifferent. Well, indifferent, you know, we can talk about that. The good and the bad, let's start with that. The task force is not actually supposed to set up the actual details of the plan. That
Yes.
will actually be transferred to the Healthcare for All Oregon board, which will be different people than are on the actual task force.
Many people, the barrier is hearing the termination of pregnancy made. It's a barrier.
Yeah.
And there's a lot of people who have trouble trying to get through that and realizing, hey, that woman made a decision a long time ago, and she should have made the decision before she got herself into trouble. So life happens. We can't tell other people how they're going to run their life, but I do know that that is a barrier for many.
Yeah, and you know, what about gender
Gender,
change
actually,
surgery?
that's a new one everyone's trying to
Right.
grasp and put their heads
Yeah.
around, yeah.
Yeah, so would we rather have people commit suicide, or would we rather pay for their gender surgery? So I would just, termination of pregnancy. So the Pope, who is from Argentina, lives in a country that has National Health Service, and so I looked up the rate of abortions in Italy compared to the United States. It's in Italy it was I think 9.8 per 1,000 women pregnancies, and in the U.S. it was 13.7 per 1,000 pregnancies. So in Italy, it's more difficult to get an abortion than it is in the U.S. Because they allow physicians to not treat that patient.
I think as a Catholic voter who is personally opposed to abortion, then I feel like I need to separate my look at this bill and whether or not I can support universal health care from the availability of abortion through the women's health services. And I really feel like that is the intention of the Catholic Church, that and I have literature, to support this, and that the U.S. Conference of Catholic Bishops absolutely thinks that it's important for people to look at anything that we're being asked to support through our faith lens and decide whether or not is this for the common good, or is this something that needs to be dealt with in a different way. And I just want to real quickly give you an example. Years ago, I'll bring in some history here. Years ago, when we had a social justice commission at St. Mary's, we had funds every single year in our church budget that were allocated to support what the Corvallis High School was doing to continue to support the education of young women who were going to that high school and who had unwanted pregnancies. We put in money to make that possible, and that was year after year we did that. And then, so I think there's another way we can do that. And then at the same time, our Social Justice Commission was exploring the possibility of sponsoring a home ministry program whereby, and this is years ago, so the world has changed since then considerably. The Social Justice Commission and its Universal Healthcare Committee were considering the possibility of sponsoring a home program whereby my husband and I, for example, had a big house with empty bedrooms. And we said, all right, we would provide housing for young women who were ostracized by their family because they had an unwanted pregnancy. Does everybody remember those days when there was such a thing as that? And it was not uncommon whatsoever. And so at any rate, that was one option that we looked at, was whether or not if we could establish a home care program so that we could provide housing, not homeless, not sleeping in somebody's car, not going from couch to couch and friends and neighbors, but a stable home where this person could stay there, and that there would be support for this woman and her child, and then counseling on what are the advantages and disadvantages of keeping the child, adopting, arranging for adoption, and so on. So there is a history behind this, and it is possible to separate this out. And for those of us who have that particular obstacle in their path, when they think about supporting universal health care, can think about what those options are. And the whole idea of intentionality, if it is my intention that I want the common good here, and that for me overrides this one issue that I don't agree with. I don't agree with providing abortion, whatever, to whomever, but I agree with providing support for people who are considering abortion. So, and then I think is something that we really need. We as a faith community and as a church need to really address that.
I'd like to just add to that, one of the things that I think is important is that in our faith, there is the response, thou shalt not judge, and thou shalt not judge thy neighbor. There is one judge. And I'm like you, I could never have an abortion, but I do not think I have the privilege and the right to tell somebody else how to live their life. And I think this will be an issue in passing the bill, because there are those faith believers like all of us, but everyone is entitled to make their own judgment, and that remains in the hands of God, in my mind, not my mind. And I'm glad I don't have to judge. So, I mean, there's probably a lot of discussion we would need to have to be able to discuss this in a way that maybe convinces other people in some way. But my faith is my faith, and I believe certain things, and everybody has a right to believe and have their relationship with God and not be judged by the rest of us. Amen.
And the church certainly teaches that.
Well, they teach it, but then look at it.
We have our conscience that we have to.
Yes.
You want to add anything to
The
this?
church teaches it, but who do
Done
we
a good
judge?
job with
Thou
that.
shalt not have an abortion.
But it is a point that it's going to be not
Yes.
just for Catholics.
No,
but
I
for
know with other churches
conservative
as well.
Christians,
right.
several of the whole identity,
Yeah.
sexual identity, and as well as the
Right,
abortion
right,
issue.
right.
And a lot of it is going to have to be resolved probably with the details that we're not discussing now for good reason of how that's all going to work. But it is there are a lot of people that don't have health care because of these stumbling blocks.
Yes.
And I think that's what
And other
People have to come
countries, they
to Jesus
manage
with.
this.
The reason, we four members of our faith community here at St. Mary's have pursued this is that we feel we need to discuss this within our faith community. And we want to encourage Father Matthias to open that door more generously.
It's the same word.
Yeah. And in his defense, I think those of us who've had this personal communications with him on these things, we know that he wants to do the right thing. and he has different people who are
Put
coming to him and pressuring him about, what about this, and what about this, and what about this? And this poor man is right in the middle of all of us. So we have to support him and be respectful in the way we communicate with each other.
The Catholic Church is trying to be more evangelical now.
Mhm.
And they don't want you to live in the world. They want you to have those morals and values that God has given us through his commandments. And they don't want us making those decisions. So we've got a lot of education.
It's way different from the 60s where
Yeah.
that was not the case. It was
Right.
primacy of conscience.
So just on the topic of abortion, I'll tell you personal experience as a medical student. I did a rotation at Emmanuel Hospital in obstetrics and gynecology in Portland. And so that's a learning situation. So I was there to learn, and a patient came in from the ER that the ER sent up to labor and delivery, and the attending asked me to go evaluate, and so I said, so I did, and I did my usual verbal evaluation, and then I reported back to my mentor and said, well, what do you think you need to do next? And I said, well, she's 23 weeks along, it would seem like an ultrasound would be appropriate. And he said, well, go ahead, go do it. And so I'd never actually done an ultrasound, but I'd seen them being done. And so I went down and I did an ultrasound, and came back and told my mentor what I found. And I said, this is my first, ultrasound, but I think I see an anencephalic child. No brain, no calvarium. And he said, oh, well, then I'll go down with you. And sure enough, that's what it was. And so that woman chose to terminate her most hoped for pregnancy, is what she had to have an abortion. So when you think about termination of pregnancy, you have to understand that there are medical indications, and we talked a little bit about the social indications. There's also economic indications. Just as you go about educating your colleagues, it's a difficult task.
The question a little bit of, so how does the medical community, wouldn't they want, as an individual, the reserve the right to be able to say, no, I don't want to perform an abortion? So in general, it's not going to force the intention would not be to have with equal, no one can be refused, etc. That's in a general statement that the medical industry or whatever profession cannot refuse this person, but an individual would have the right to refuse that kind of a particular procedure.
Yeah, and that's how in Italy, what I read was that 60% of the physicians choose to not perform abortions, which is what makes it more difficult for the women who wanted that option to actually get an abortion. Yeah, I think that, in my opinion, that's very reasonable, and that's an opinion that needs to come out in public testimony when the task force comes around, and that will make a better plan if we get those obstacles addressed. Okay, so the thing I like about the values section the most, well, I don't know, is number 4, is that the funding is a public trust. Any savings or excess revenue are to be returned to the public trust. I had a bit of a hand in that one.
Good.
Well, that's good because.
You put his
usually there's
initials
savings,
after it, please.
everybody's grabbing
Thought about leaving it out.
And that is really important to voters because
Yes.
I don't know how many times people have complained. Well, I voted for this bill with the understanding that the revenue from it was gonna go to so-and-so and so-and-so. And then I find out now they're using it for such and such.
Yes.
So this is a very, very important issue, not just with healthcare, but with just in general, how we work with legislation.
Number 3 is important because of the corruption that can go on.
Yeah. Oh, boy.
Being
Don't
human.
get me started.
And the management is a very important component, I think, to make sure that's clean and well
Yeah.
supervised.
Yeah.
In fact, there's a new bill that passed both houses about financial management of public monies in our CCOs.
Oh, good.
Because there's certain stuff that's trade secrets, and OHA doesn't think they're trade secrets. So letting the CCOs know about that.
Mm.
It's not perfect, but it's way better than it has been.
So explain what OHA is.
Oregon Health Authority.
Not everybody knows.
Yeah, so that's a big department in the state government. Yeah, in fact, they manage, the money that comes in for Medicaid is like $9 billion, which is more than the state budget.
Wow.
So, okay, section 5, who would like to read the principles?
I can do that. The Task Force on Universal Health Care, in developing its recommendations for the Healthcare for All Oregon Plan, shall consider at a minimum the following principles. Number 1, a participant in the plan may choose any individual provider who is licensed, certified, or registered in this state or any group practice. Number 2, the plan may not discriminate against any individual provider who is licensed, certified, or registered in this state to provide services covered by the plan and who is acting within the provider's scope of practice. Number 3, a participant and the participant's provider shall determine within the scope of services covered within each category of care and within the plan's perimeters for standards of care and requirements for prior authorization, whether a treatment is medically necessary or medically appropriate for that participant. So that's new.
Yeah.
The plan, number 4, will cover services from birth to death based on evidence-informed decisions as determined by the Healthcare for All Oregon Board.
So does this cover dental at all?
This task force is going to come up with recommendations to the board that will be elected or appointed and somewhat elected, so that they will decide what the coverage will be. But certainly all along, there's been, in the various bills that have preceded this one, there has been an understanding that there would be really comprehensive coverage.
Yeah.
Oral health is very, very important.
From birth to death.
Canada has not changed their system since 1970 or so, and they still exclude
They
dental,
do, I know.
vision,
I know.
and drugs, and they regret it. I mean,
Yeah, yeah.
People who want
It's
to
a
get
big
care.
problem.
So we have to decide that,
Mhm.
and that's going to depend on how much we want to pay.
Mhm.
On number 3, where you decide whether a treatment is medically necessary or appropriate. Does that take into consideration how the mental aspect of it? I mean, where you may not think it's medically appropriate, but for that person, the patient, mentally, it may be crucial.
Mhm.
So the provider might not think it was medically indicated, or,
Right.
but the patient would think it's medically.
It won't be determined specifically for each thing. Okay, so I maybe watched too much New Amsterdam. Woman had her surgery to lose weight and has all this excess skin, but her insurance will not cover that.
Oh, yeah, sure.
And so mentally, emotionally,
Yeah,
she was a wreck.
yeah. Understandably.
So that's kind of why I'm facing.
That happens in real life.
And yes, that would happen in real life. I've heard of people like,
Those questions will come up in the next chapter of this journey, this pathway.
Okay.
So could you explain 3? What's your understanding of it?
Okay, so what 3 is talking about is, well, for instance, it's about prior authorization, getting prior authorization. So in private insurance, the patient and physician say, well, this is what I think you need.
Mhm.
And the prior auth comes back and says, well, we don't cover it, or we disagree, or send us more information. And so there's this back and forth that usually the insurance company wins. If you've ever been involved, and I have been involved in many of these situations, the insurance company wins. And that actually discourages people from, there's OI Office of Inspector General report about in Medicare Advantage organizations, how this plays out for enrollees. So any private insurance, that's the game.
Mhm.
It's about delaying and denying care, and that's, after all, how they make their money. So this is addressing that part of it, where it's the provider and the patient is number one, and so there needs to be some kind of appeals process built into this. But as a fundamental principle, it's the provider and the patient who decide what's medically necessary.
And the provider being the actual medical care professional,
Yes.
It's not referring to the insurance.
Right, yes.
Or
yes.
some kind of a board.
Right, yeah.
As a first level.
Yeah.
Okay. That's what I thought.
I have a question. When I'm reading number 4, it will cover services from birth to death, and then it says based on evidence-informed decisions. Well, if the baby's coming, the baby's going to be born, and if the person's dying, the person's going to die. I don't understand based on, explain to me on evidence-informed decisions about birth and death. I don't understand the phrasing.
Yeah, so there are, and it doesn't explicitly state it, but it covers prenatal care. If you have,
Yes.
if you're born and you are going to have a child, you are covered.
Yes,
Right?
yes, so that's what I'm just, I don't understand what it's about.
So evidence-based so there are, because the concept here is that alternative therapies would be covered. So chiropractic, homeopathy would also be covered, but there's some standard that the therapy needs to meet in order for it to be paid for by this plan. It's not someone injecting small quantities of a vaccination into a patient that will never become therapeutic. They're not going to cover that,
right,
because science says that doesn't work.
Okay.
It's someone's idea who, now this provider has 30 patients that are bringing their kids in to get these micro doses of vaccination and claiming that they're vaccinated. and it's, no insurance is going to cover that, and this isn't going to cover it either,
Right.
because there's no evidence for it.
Evidence,
Yeah.
I understand it now. It's the word services, I think, that I was missing out.
Oh.
I mean, services, what you struck for me was I recently had the car accident, and then I needed some things sort of outside my plan for healthcare, and it had to be approved for me to be able to get the service like acupuncture before the insurance would cover it. So I'm connecting it with my own personal thing. So when you mentioned services again, I understood better what this actually
So
is
do you have a
approval for.
suggestion for another verbiage that would make it clear?
Well, I have to think about that.
Okay, I mean, really?
Yes.
And by the way, this is really what the task force is going to be doing. They are required in this bill to carry out an extensive process of going around the state and meeting with people and talking about the numerous instances where it says the task force shall, must
Yes.
develop recommendations on these important components. And this is certainly one of them.
Seems to me that part of the problem is the evidence-informed decisions. It sounds like it's a care provider's decision, and it's not pointing to that.
Well, no, it would actually be the board's decision of what will be covered services based on evidence, not based on
Request.
someone says,
Yes, yeah,
well,
I like
I want to
that.
do this
Yes,
because
yes.
I've had, 3 patients that have benefited
Yes.
from it. Yeah.
It seems to me it's based on the clinical.
Yes, the clinical
Yeah.
evidence for effectiveness. And the Healthcare for All Oregon Board would be the group that would be actually
Defining
formulating
what
that.
How about hospice? You talk about birth to death. Is that covered, the hospice services?
Yeah, so that will be discussed by the task force, and also long-term care will be discussed by the task force.
Mhm.
Yeah, so they actually need
Those are
to
the services.
prepare a plan including long-term care and not including long-term
And
care.
then hospice could be like something separate from long-term care.
What we really want to figure out is where do we go from here? In preparing our faith community at St. Mary's, and also sharing that with other faith communities through Interfaith Healthcare Network, if we're continue to be involved in that. What our experience with this kind of discussion. We want to make sure that our faith community and others throughout the state have the opportunity to participate in these meetings with the task force. Not only when they make the grand tour, which will happen more than once, I'm sure, during the next 2 years, but also in the meantime, going to Salem, observing what they're doing at the task force meetings. They will be having regular meetings. They are public meetings. We want to have a mechanism through Mid-Valley Healthcare Advocates and through Interfaith Healthcare Network for letting people know the task force is going to be talking about eligibility next Wednesday. Do you want to go carpool with so-and-so and so-and-so? And here's some background information. We want to prepare our parishioners so that they really give careful thought to what's going to go into this bill and that they participate. And then they can ensure that other faith communities do this. I mean, this is a wonderful opportunity for us to live our faith. So I'm looking at Linda and she's saying, the Lord has asked us to follow him and to love one another. Well, how do you love one another? You help them be healthy and learn how to be healthy. And then let people know when you're not healthy and what you need. So this is a faith-based approach to living the life the Lord has called us to.
Amen.
So, amen.
And remember, besides being less expensive and having better health outcomes, the best reason to do this is because it's the right thing to do.
Yes, common good.
I think we need to give our priests all the tools we can provide
Yes.
to help him communicate
Yes, yes.
with people who.
And tell him we would like, if somebody comes to him and has all these complaints, would he be willing to refer that person to one of us, where hopefully we will be able to talk with this person, not to twist their arm off, but to answer whatever their questions are. What are your objections? And then we can give a response to that in a respectful way, and we will build a communication dialogue that has been missing, for a long time.
It seems
I
like.
mean, this is momentous, what we're talking about here. Opening the door to this kind of communication within our parishes is momentous. And I think Father Matthias has to be a very brave man.
Well, especially since we're dealing with a different culture.
Mhm.
And we've got to
Right.
know what we're dealing with from
Right.
that culture, and I'm not sure we all do,
No,
in order to get his understanding.
yeah,
Because he doesn't know our culture other than the short time that he's been here.
right. That's a very, very good
But
point.
even priests that know our culture will not
Oh,
discuss
and,
this.
well, but at least they know the culture, they've got the history.
I live in a parish like that.
Yeah.
Well, what you're saying is at one point, St. Mary's was the lead in all this, and now we are way in the background. We've lost hold because.
And why can't we do both?
Yeah.
I mean, I don't think we have to leave one. I believe the Lord calls all of us who have the gift of faith to share that faith with other people. And we can do it in lots of different ways. With my behavior, with the way I treat other people. There are lots of ways you live your faith. So I don't think we have to give up one to do the other. So Right.
We have to get access to the rest of the community of the St. Mary's if we really want to be able to
Mhm.
start a fire under people and have St. Mary's
Yeah.
participate. So the access is the
And
problem.
again, I want to really emphasize the kind of communication we have had with Father Matthias. He's been sweet, he's been thoughtful, he's listened, but at any rate, we haven't quite made the place. He has made it clear that he has no objection to our giving him names of maybe several people who would be willing to participate as a St. Mary's representative on the Mid-Valley and the Interfaith Healthcare Network. And that's progress. I hold on to that. To me, that is progress. Now, if any of you are interested, this is one of the things I'm doing now, is I'm talking to people, and anybody who's interested in being a representative on that Interfaith Healthcare Network. There are 6 other denominations and faith communities that are involved in that now. And in its mission, look at the statement here across the top. Its mission is almost identical to the verbiage in the mission for Mid-Valley Healthcare Advocates. We are a community of people of faith. It's called to educate and advocate for healthcare systems serving everyone in Oregon. This system will be equitable, affordable, comprehensive, and publicly funded. So it's there. And
So Betty, is Father involved with this interfaith care group at all yet?
no,
Okay, that's probably where the problem is.
I don't think he even really knows.
Knows
that
about it.
That it exists.
Well,
You
we
said-
had
So
told
we've
him.
had groundwork that he could have
we
been
had
involved
told
in.
him about this, but telling somebody about something is one thing. So I think going back to him, I mean, we're looking at now to answer the question, what are the next steps? Maybe one of the things you're getting at, Kathy, is that we would go back to him and go over this with him again. We handed this to him at one of the meetings, and I mean, so he spent 3 minutes looking at it.
Could
Yeah.
we invite him to go to one of the meetings
Yeah,
with
but-
the pastors of the other?
Yeah.
Okay,
Interfaith Healthcare Network is different than interfaith caregivers.
okay.
It's two different things. The caregivers deliver services to
Two
people,
different
like
groups is what you're saying.
providing grocery shopping help for me, for example. So this is a network of, there's people from the Mennonite Church in Albany. There's people from the Episcopal Presbyterian, and thanks to this man and all his buddies from the First Congregational Church, who are part of this and really involved in making it happen. It's been, to me, it's a sleeping giant. When you think back of the role of congregations and faith communities with the civil rights movement, I mean, there's no limit to what those people did that opened the door for that to make it happen, you know. Same way with women's rights. I mean, anyway, the churches are this is the sleeping giant. And I think Mid-Valley Healthcare Advocates and its partner, Healthcare for All Oregon, and a lot of other advocacy groups recognize that church groups can be very influential in educating their members and advocating for certain social justice issues that we need to be aware of.